Welcome, everybody, to episode number 9 of the Merck at Work podcast. Today, we have Elena Turner from Commonwealth Pain and Spine with us. Welcome, Elena.
Thanks, Kyle. I'm happy to be here.
Yeah, Elena, we met a while back, and we're neighbors at some point, and got to know each other through your current position, and just excited to have you and learn a little bit more about what you're doing and what's going on with some of your surgery centers and what it's like to be an administrator in those.
Well, I'm happy to be here, Kyle.
Sounds great. Well, let's just hop right in. Why don't you give yourself a little bit of an intro, talk a little bit about your career path and where that's brought you to Commonwealth now and what you guys are doing. I know you've got some exciting things going on, so give a little background and how that's where that's led to today.
Yeah, absolutely. So my name is Elena Turner. I started off as a staff nurse in the OR in Madison, and instantly fell in love, knew that's what I had to do for the rest of my life. A wise man once told me, if you can find something that you enjoy doing for free, figure out how to get paid for it. And I would do surgery for free, and I do surgery for free. Every year we go to Guatemala on a mission trip, and so if I can do it for free, I can absolutely get paid for it. I worked my way up to the director of surgical services there at that hospital here in Madison. Once I completed my master's degree, moved to the ASC space in late in 21, as an administrator. Then opened a second ASC. That's not part of the plan, but it happened. Opened a second ASC for that company in Louisville. That company was then sold. Part of it was supposed to be sold to Commonwealth. Part of it was sold to another competitor. Went to work for them for just a very short time until I ended up with Commonwealth. As soon as I met Jeff and Janet, I just knew that's where I was supposed to be. I'm very in tune to when my brain says this is what you're supposed to do. This is what I tend to listen. So went to Commonwealth. Been there. Started last year. I've been there almost a year now, and a lot has happened.
Yeah.
Working on open surgery centers in Elizabethtown, Kentucky, and New Albany. The Evansville Center is going to start seeing its first patients next week, so I'll be there for that.
Awesome. Congratulations on that.
Thank you. It's been a long time coming, and it's very exciting. So it'll be fun seeing patients again for sure, especially in that beautiful space. It's really is truly a gorgeous center.
Yeah.
So there I did a lot of working with contractors and vendors and CapEx budgets and that kind of thing to get that place ready. And then one of the nurses that I worked, that was my colleague at one of the previous places I worked at, she's come over to be the administrator there. So she's taken on a lot of the day-to-day stuff there. So I don't have a lot to do with Evansville anymore. Additionally, they've had me tour in other spaces for mergers and acquisitions, seeing what the possibilities are of expanding the Commonwealth footprint even further. Additionally, we spent a lot of time going to conferences and things like that, doing podcasts, things like that, just so that we can continue to sort of expand our role, Commonwealth's role, in surgical services space, and just stay at the forefront of, standard changes and guidelines, and just expanding what we can offer to patients.
Yeah. Yeah. Just knowing Janet the way that I do and yourself, you both are out there. Like you said, you're kind of getting out in front of everybody and just trying to share your story. And it's exciting to see people that are doing it that way. And it's inspired us a little bit too, because that's, we're trying to grow by being more present and available to folks as well. So
yeah, for sure.
Appreciate you sharing that. One of the things that I had told you before when we were getting ready to do this episode is I'd like to kind of learn what a day in the life of a surgery center administrator looks like. We see it, when we're on site doing inventories and, um, some of the services we offer. But I'd like to get your perspective of what it's like on a day-to-day basis for a surgery center.
Sure. So my my role currently is totally different from a typical day in the life of an administrator because we're still in the construction phase on
Correct.
the two
Yeah.
that I'm going to be acting as administrator in. So, but typically, and the way it'll be again once the surgery centers are completed and ready, typical day kind of looks like I arrive early, making sure I'm there, my staff is there, the required staff is there, and if they're not, where are they? Can we run with
Mhm.
what we have? Do that, make sure everything's ready before the patients get there. Got to make sure you have all your supplies and equipment ready, and typically that's sort of delegated out. Make sure that your OR nurses have everything pulled for the next day, so that you're not scrambling doing that stuff the day of. Nobody likes a
Yeah,
canceled case day of. So
and you guys start early, so doing
yes,
that
we do.
really early scrambling would be tough.
Yep, yep, and to tell a patient, I'm sorry, we can't do your case because we don't have this thing, that should never happen the day of. It's
Yeah.
sometimes, things happen and you might not have what you need, or somebody's sick or whatever, and you have no choice, but
Hmm.
it shouldn't ever be our fault for a same day cancellation or something like that. So just making sure everything's ready to go before any of the patients get there. Um, Additionally, you want to make sure everybody knows their specific roles for the day. Again, that should be done the day before, and it's usually done by the charge nurse, not necessarily the administrator, but we want to make sure that that was completed.
Hmm.
Um, I personally feel like the administrator should always be available to assist in any area of the center, whether that's making sure staff gets breaks, if we're available to take a case if something happens to one of our staff, making sure they get lunch, making sure rooms get turned over, um, be there for any concerns or questions, take care of any complaints. Hopefully there are none, but sometimes there are. And obviously, just oversee operations to make sure guidelines and standards are followed, that policies are followed. And there's a million other things we do during the day, like temperature and humidity checks, generator logs, NARC counts, defib checks, interviews, but literally the most important things are in regards to the patients and the staff.
Yeah.
And typically, in my world, it's maybe not how it is everywhere, but I'm the last person to leave for the day. I don't leave until every patient is discharged from our center, and I don't leave until all my staff are out. Then making sure the center is locked and secured for the night. Typically is what this looks like. Not what it looks like today. Today is a whole lot of vendors and capital budget and just construction stuff. So it's quite a bit different, but being on that part of it really helps, I think, make things more user friendly in the end. So if I say, hey,
Hmm.
this doesn't make sense to have this office over here, can we move it over there because it makes more sense to me? And they do, then it's a little bit easier for me to do my job later, just because it's sort of ease of use is a little bit better.
Yeah, your experience has actually been beneficial for design and all of those kind of things. Those are um, that's you know totally irreplaceable. That's something that, having your background and your capabilities as a nurse and things like that, you have so much information and knowledge stored up that, being able to have say on how things look inside the surgery center is really, really valuable. So um, that's a cool perspective to know and have, and that you're getting to use it that way beyond
Yeah, I
just.
mean, it's definitely fun being able to, because we had built a new hospital here in Madison quite a few
Mhm.
years ago now. But when I first started working there, they were building it, and um, they shouldn't have asked me anything. I was brand new, I didn't know anything. But there are a few things where like they asked certain people, and it just made things make more sense. And there was a few things where they were like, they should have asked and maybe didn't, or maybe they did and there was a reason why they couldn't do it. But
Yeah.
just having that perspective and sort of that influence on what does it look like, what does the flow look like, and have actually people
Mhm.
actually listen, just is huge. I mean, it's massive because the end users are the people that are going to be there working in that space. It's not going to be the architects or the construction guys. It's going to
Yeah.
be us that are working in there. So it's super neat to be part of that for sure.
Yeah. Side note, my daughter was actually born in the hospital in Madison, so
That was my son.
yeah, that's awesome. We've crossed, I'm sure even before we knew each other, we probably crossed paths multiple times.
Yeah, yeah,
So, one of the other things tying into, the day in the life, or what are some skills, capabilities, or leadership qualities that you see that are really valuable in an administrator, or things that you work on, or things that you've witnessed and admired? I'd be interested to know about that as well.
sure. What's great about Commonwealth is that all of our surgery center administrators are nurses, with surgery experience, and
Yeah.
I personally feel like that gives us an edge over maybe somebody who's an MBA,
Hmm.
or an MHA. I'm not saying they don't know how to do their jobs. They absolutely do, but there's a lot that we can do as
Hmm.
nurses that those other administrators that aren't nurses can't do, such as just taking a room by ourselves, taking care of a patient, doing basically everything, every job in the surgery center we can do, legally.
Yeah.
Whether we can physically, if it's our expertise or not, is a different story, but legally, in the event that you needed a nurse, you have a nurse, right?
Yeah.
So I think that that's super important. Again, not a requirement, and I'm not dissing anybody who's not a nurse who's because I'm sure they know what they're doing. But
Yeah.
I just think it's great, um, because I was just taught on a different level, and I've worked with a lot of other healthcare professionals as they have. But like I said, there's nothing that we can't do in the ASC space. Um, and I've been fortunate, super fortunate, to be mentored by some of the greatest nurses I think that have ever walked the planet. Whether that's from, my instructors were just amazing, even from my ASN, and then I had those same instructors for my bachelor's, so that was really great because we had that rapport already. And then, I didn't really meet my instructors for my master's degree because that was all online during COVID. So never met those folks, but in my work life, I've had some just amazing mentors, some nurses that have been nurses for a very long time,
Hmm.
that absolutely had a passion for not only helping patients, but also molding younger nurses into what we need nurses to be in the future.
Hmm.
As we see some issues with, shortages, and you
Yeah.
know the instructors were all boomers and they're all retiring, and those of us that are my age, we don't necessarily want to be instructors just yet, maybe later. But
Yeah.
so it's hard to breed more nurses if we don't have the people that are going to teach those nurses. So um
Yeah.
so those nurses really did um mean a lot to me, and really molded me as a nurse and as a leader. But personally, I think that some of the skill sets that are important are going to include strategic thinking. You have to do less
Mhm.
with more sometimes. If somebody doesn't show up for work, you have who you have, and you still have to get the job done. The
Yeah.
owners, the physicians, and the patients are all going to expect the work to get done,
Hmm.
whether you have what you thought you were going to have or not. So being strategic, thinking outside the box, and getting that done is going to be super important for an ASC leader. Honesty and trustworthiness in the OR, you have to be able to trust each other. So being honest 100% of the time, even if you think you're going to get in trouble for, you know, I contaminated something and wasted it. I don't want to get in trouble for wasting. I would much
Yeah.
rather waste something than put someone at risk. So I want to be able to trust that when you say, nope, everything's good, nothing's been contaminated, I want to be able to trust that.
Yeah.
And that goes vice versa. I want every single thing that comes out of my mouth to my staff to be very honest. Maybe there's stuff that I can't tell them because it's not
Hmm.
on the docket for me to explain that to them. But it's not that I'm keeping anything from them, and I would never lie to them. If they have a specific question that I am not able to answer, then I would direct them to the person that could answer it.
Yep.
So it's super, super important that we can be honest with each other and trust each other completely. And of course, like I said, I think it's important for the administrator to get in the rooms, help with the cases, even if it's just to get them lunch breaks or bathroom breaks, turn rooms over, just whatever, anything that is going to help get the work done so that they don't feel like they're doing all the work and I'm sitting in my fancy little office sipping tea or whatever.
Yeah.
So it's super important that I have their respect as a coworker, but also
Yeah.
as a supervisor. So it's important for me to get in there and do that.
Yeah. We always have the thinking that, you lead by example, and you would do any job inside of your organization can be done by anybody. So whether you're executive level or leadership, floors need to be mopped, you do it. And that shows that everybody's pulling in the same direction, and that's exactly what you're just talking about. And even Janet talked about it when we had her on the podcast about, she said being an administrator is, there's days that you got to go work the OR, and because somebody called in sick, and you touched on that as well. So it is really, it's kind of a jack of all trades.
Mm-hmm. Yeah, her and I will both be checking patients in at Evansville next week, so it'll be fun.
That's neat. That's like, it's a little bit of the past and
Yep,
some of your previous roles, and more administrative roles all happening at once.
yep, yep.
That's exciting. I had the opportunity to drive by, the Evansville facility, working in Evansville, and it is a beautiful facility. I can vouch for that.
Yeah, it really is. You stop by sometime, let Laura give you a tour on the inside. It's something else.
Sounds good. I'll have to swing by the New Albany one as well. That one's very close, so
Yeah, yeah.
good deal. Well, what's kind of next? I know you've talked a little bit about Evansville's opening up this week to see patients. New Albany's kind of coming. You mentioned Elizabethtown. I don't want you to give out any trade secrets or anything like that, but anything you can share about things that you're working on or things that Commonwealth is doing that is exciting for folks to hear about.
Sure,
Let's
sure.
hear it.
Yeah. So next, obviously, is getting New Albany and Elizabethtown ready to take care of patients. That's the end goal for every center, right? Get them ready to see patients.
Correct.
Um, Once they're ready, I'll spend the vast majority of my time in those two centers, taking on the role of administrator for both for a while. And then once New
Mhm.
Albany's at capacity, I'll step away from Elizabethtown, give that to someone else. Let them deal with that. And then just
Save
spend
your
my time in
travel a little bit.
Exactly, exactly. Spend my time in New Albany where I belong. And then obviously as Commonwealth continues to expand, I look forward to being the point person for new administrators, assist them with their CapEx budgets, helping them get through licensing and certification processes. And of course, I'll continue to speak at conferences and attend conferences to learn how we can expand our service lines, take care of patients, just as many as possible, and just really try and help as many patients as we can. And really, whatever Commonwealth asks me to do, I'll do it. I fully
Yeah.
believe in their mission, and they really just want to take care of patients, and that's all I want to do. So, if they ask me to go to the moon with them, I'm going. So,
That might not be that far off these
yeah,
days.
that's it.
That's exciting. No, I see you guys are always out on the conference trail, and appreciate that. And we're definitely looking at some of those as well. So hopefully our paths cross on some of those.
Yeah, we got a lot coming up. I'll be at AORN next weekend, and then we'll both be at ASCA in Denver
Yeah,
end of next month. Yeah. So we got some stuff coming up.
good deal. Well, us, we're an asset management and capital planning type company. And I just wanted to get your thoughts on, the role of capital equipment and asset management, and what an administrator's perspective of the equipment in the surgery center, what the value of that is, and what understanding that the whole role of asset management is for yourself.
Oh yeah, I think it's intensely important. Coming from someone who has spent literally the last month day in and day out going over a capital equipment budget. Um, uh, Quite a lot of money is spent on those pieces of equipment. Obviously, you want them to be safe and efficient for your patients and for your staff. Um, they're going to be expensive. And so
Yeah,
tracking what you've spent on them, what they're worth, what their useful life left is
yeah,
incredibly important. I think that obviously anybody who's worked a significant amount of time in surgery has done the annual inventory. We've counted every screw and every plate and every lac pack or blade, for all of the things. But it wasn't until I became a director that I realized how important it was also to inventory your equipment. Know what the depreciated value is, know when it's at its end of life, when is it no longer serviced, when do you absolutely have to get it out of there, when is it going to start
mhm,
costing you money to keep it in there because you think that oh, it still works today, we'll keep it, and
yeah,
then it does not work that way. So it's
yeah,
super important as an administrator to be able to say, here's what we paid for it, here's what we've gotten use for it over time, and here's where we're at. Is it
mhm,
more important? Is it more logical at this point to replace that piece of equipment versus fix it again? Um,
yeah,
I mean, there's a couple other pieces to that too, right? So like if the sterilizer's down again, then your staff starts getting frustrated. And,
yeah,
certainly we can afford a new sterilizer, but then you have to be able to make sure that those numbers actually work that way. And if they do, then yes, let's get rid of it. Is it worth it to me to not have my staff frustrated over that thing that is broke again?
yeah,
So that's super important. Um, I think it's important to be able to see if there's any active recalls on equipment, um, regular service plans that have been completed on those pieces of equipment. It's just like if you rebuild an old car, right? People are going to want to see, what did you put into it? Did you keep receipts? Did you show me your service records? If I'm going to sell a sterilizer, somebody's going to want to see, when did you last have it serviced and who's
yeah,
servicing it? Is it Dave out of his garage or is it
yeah,
somebody who's reputable? So I think it's important to show those kinds of things. And obviously the administrators report to higher level executives, right? We want to tell them, what are things that might need to be replaced in the near future? We're telling the medical executive committee, we're telling the governing board, we're telling the owners, but it needs to be in a format that they can kind of understand. Simple, clear, concise, easy to interpret. Just let me see one page that shows me that we actually really do need to replace this versus me just saying, we really should replace it.
yeah,
Isn't going to cut it with them. They're going to want to see some concrete evidence, and having an inventory management program like this will definitely help get that job accomplished for sure.
yeah. Just having the shiny new thing isn't always the best avenue, and something you touched on earlier that I know that you understand, and we've had discussions about, is the whole premise of driving the wheels off something isn't always the most financially prudent idea. You have to really think, what you were talking about earlier is, when's the right time to get rid of a piece of equipment, what are all the cost ramifications, and where's the value at, and how have you used it, and what kind of profits are turning on this piece of equipment. There's so many things to factor in on the right time to, decommission or buy or trade in. And you touched on that. And that's, you have a good grip of that. And I've always appreciated that.
Thank you. I appreciate that.
Yeah. Well, one of the things we like to do as we start wrapping up the podcast is get a little bit, more familiar with you on a personal side. I know you're a Jeep and a car person, and some of the other hobbies you've told us about, but share some of those, and definitely give the story of the Phoenix.
Oh, sure, sure. Um, well, at my core, I'm a family person. My husband's a nurse.
Oh,
We got
wow.
we got 5 kids. The oldest one is Zane. He's a Christian school principal. The oldest girl is Katie. She's an OB nurse.
Wow.
Um,
Runs in the family.
yeah, it really does. It really does. Um, Trey, our son, works for Pepsi. Kylie is a pharmacy tech and is currently in pharmacy school. She'll be a pharmacist in about 2.5 years, so I'm pretty excited for her on that.
That's great.
And then my Leafy is a junior in high school, so he keeps us busy with band. He's in every band you can be in. He plays 6 different instruments, so it's pretty intense with him sometimes.
So all those guitars hanging there, they have
Yeah,
purpose.
yeah, tubas, trombones, trumpets, pianos, guitars. Yeah, the house is covered in musical instruments, and it's
That's
mostly
great.
him. It's mostly him. And so those 5 plus our 2 Dobermans keep us super busy.
Oh yeah.
And obviously, when we have free time, we're on Jeep rides with our local Jeep crew in the Phoenix. And then we spend an awful lot of time fixing up my son's 74 Dart. So that's in the middle of restoration. It's mechanically been restored, and now we're doing cosmetic stuff. So it's going to be really fun. Um,
That's cool.
yeah, and so the Phoenix is a fun story. It didn't start off as a fun story, but it is now.
But it's
I,
now,
yeah,
yeah.
I can smile about it now. So I had a big old white winter edition Sahara Wrangler that was just absolutely perfection. And I love that Jeep, and that was the Bumble, the Abominable Snowman. And one day when my son was driving down Clifty Drive, it decided to spontaneously combust,
Oh
and it was totaled, and I was brokenhearted. And I told my husband, well, we'll just wait. It was summertime, so I thought, well, we'll just drive the Mustang and I'll find the right car. And I lasted about 3 days before we went and bought a little black Jeep because I just missed my Jeep so much. So I knew right away that the Jeep was going to be the Phoenix because this fire wasn't going to get us down. We were going to emerge stronger. Super cliche, but it worked.
yeah,
And it makes me feel a whole lot better. That Jeep was a part of my life, and we got to do a lot of fun stuff in it. And um,
yeah,
so the new one is black and has flames all over it, and the big phoenix on the hood. And but there are bumbles hidden all over that Jeep just to pay homage to that one because I am a car person, and I get super attached to them, and I like to put a lot of work into them. And um, I was just raised that way. I mean,
yeah.
my mom would do Sunday afternoon memories, and one of her Sunday afternoon memories was she put on Facebook for us to remember forever what car we came home from the hospital in. I came home from the hospital in a 74 Valiant. So, I mean, I can honestly.
Yeah, you know all the with her sharing all that, every car that's been in the family.
Exactly, I do.
That's great. Well, what's next on the Phoenix? I know you're constantly working on it. So what's
Yeah,
most
next.
recent and what's coming?
Yeah, so we just got the winch put on the front. And we're working on, I have this, I don't know if you guys saw it when you were here last, but I have this little flame coming out of my trailer hitch, and the guys are working on figuring out how to wire it so that it lights up.
Oh wow.
And I hit my brakes. Yeah, so it's going to be pretty cool. Sort of a one of a kind little thing that's just for the Phoenix. But this next weekend, the Jeep Club is going to have its very first ever Phantom Run car show here in Madison. And so the Jeep will be there. Unfortunately, I'll be in Boston at a conference, um, but the Jeep will be there. We went on a Jeep benefit run last weekend. So that was a lot of fun for a guy here in town that had some medical issues.
Mhm.
And he's doing a lot better. So we raised a ton of money for him and his family. So it's
Great.
just fun being part of that community because that's what they're really all about is just getting outside, having fun, and doing good things for other people.
Yeah, it's when you get in a group like that, and especially amongst other car people, it is fun. We did when I was younger, my family and I did a benefit car show for a young guy who was dealing with cancer, and thankfully, last I heard, he's still with us, and that was in the mid '90s. But yeah, we had a bunch of classic cars and raised a bunch of money for him and for his medical bills. So the car people, they like to pull together to help people out.
Yeah, they do.
Well, anything else you want to share, or any other exciting things coming for you or Commonwealth, or
I don't
did
know if
we
I can handle
cover
too
it
many
all?
more exciting things.
You're like, hey, let's make it not quite as busy, but
Yeah,
that makes it
it's
fun.
gonna be both strange and beautiful to be back in the ASC space, just doing the administrator duties versus all this stuff. But I wouldn't trade it for the world. I'm learning a lot and doing a lot, and it's definitely changed my perception of how these things go up and how they should go up,
Hmm.
and what truly is important to me as an administrator, as a nurse, as a leader. Um,
Hmm.
you know, when we're talking about the workspace, it's important for me that the staff are comfortable and it's easy for them to work there. They want to work there. They're proud of where they work,
Yeah.
which is huge for us. You know, we've all worked in some places that we thought, wow, this maybe not where I belong, but
Yeah.
you do what you do, and something keeps bringing you back. And every time it's the patients and my staff that bring me back. So it's gonna be excellent to work in a facility that's um, really just state of the art.
Yeah. And the experience you're gaining from all of this is, you know, it's invaluable. You're gonna learn so much and be able to, like you were talking about earlier, pass that down to another generation of inquisitive nursing minds that want to follow in your footsteps.
Of course, yeah. I mean, that's the goal, is to get them all. Maybe not all of them. Not everybody wants to be in leadership or an
Yeah.
administrator, and that's fine. That's it's not for everybody.
Hmm.
But anybody who does, I welcome the opportunity to teach them maybe the kind of administrator they want to be, or maybe the kind of administrator they don't want to be. I mean, the
Yeah.
goal is for them to learn something from me, even if it's that I'm not what they want to be like.
Yeah. Yeah. And I love the how you talked about having your workplace be somewhere that your staff's proud of. I just said that on our most recent podcast. It was that was a goal of mine in our company, and I we were talking about a 5 year plan and goal, and I said, really at the end of the day too, I want the folks that work for us to be happy and proud of where they are. So we share that common vision.
Yeah, for sure. For sure. It's super important.
Well, Elena, it's been a pleasure. Thanks so much for joining. Have a great weekend, and um, we'll talk to you again soon.
All right. Thanks, Kyle. Thanks for having me. Tell Wade
Yeah.
I said hi.
Yeah, we'll do. Thanks a
All right.
lot.
Thanks. Bye bye.